In this lecture, we will discuss the basic function of the heart and then review its electrical conduction system. Let's start off by taking a look at the anatomy of the heart. In the left image, you can see that the heart is in the middle of the chest cavity. So you can see here. It typically sits at a slight angle pointing downward to the left and slightly anterior. The middle image shows an anterior view of the heart. And as you can see here, the right ventricle takes up the majority of this view. Here's the right ventricle, and as you can see, it takes up a majority of this anterior view. The image on the right shows a cross-sectional view of the heart. Here we can see the four chambers of the heart. Here you have the right atrium, and on this side you have the left atrium, as you can see. You also have the right ventricle and the left ventricle. And coming from the right ventricle, as you can see here, comes out the pulmonary artery, and from the left ventricle, the aorta. We can think of the heart as a pump consisting of four main chambers, two atria and two ventricles. Here we have the right atrium and the left atrium, the right ventricle and the left ventricle. It circulates blood through a closed system. The atria empty into their corresponding ventricles. As you see here, the right atrium empties into the right ventricle and the left atrium into the left ventricle. The blood that empties from the right atrium into the right ventricle then goes into the pulmonary circulation through the pulmonary artery. So it comes up through here. And the blood that comes back from the lungs into the left atrium, enters into the left ventricle, and then goes out through to the peripheral circulation through the aorta. Remember, veins bring blood to the heart, as you can see the vena cava system bringing blood back to the heart, to the right atrium, and the arteries take blood away from the heart, such as the pulmonary artery is doing so from the right ventricle. Now let's turn to the electrical conduction system of the heart. It is made up of specialized cells, some of which have pacemaking functions and others that allow transmission of impulses to travel through them. The main function of this system is to create an electrical impulse and transmit it into an organized manner to the rest of the myocardium. This is an electrical chemical process that creates an electrical energy that is captured by the electrodes when we perform an EKG. As you may recognize, the electrical conduction system normally starts at the SA node, the pacemaker, and travels through the internodal pathways, as seen here, to the AV node, and then through the His bundle, and then to the right and left bundle branches, and eventually ends in the Purkinje fibers. The Purkinje fibers directly innervate the myocardial cells, which then spread by direct contact with each other. We'll take a look at the system in more depth shortly. Before moving on, note in the image on the right that you can see the conduction system is actually within the walls of the heart. You may have heard of the pacemaker activity of the heart. Let's take a moment to discuss what it is and its purpose. The pacemaker dictates the rate at which the heart will cycle through its pumping action to circulate blood throughout the body. It does so in an organized fashion. The pacemaker sets the pace, and then all cells follow its pace. The SA node, which we see here, is in the right atrium. It typically fills the role as the pacemaker of the heart. The SA node receives input from various areas of the body, including the nervous, circulatory, and endocrine systems, in response to the needs of the body. The main pacemaker, as we said, the SA node, tends to pace at a rate between 60 and 100 beats per minute. As with other parts of the body, if the SA node fails to fire an electrical impulse, there is a backup. It is important to note that every cell in the conduction system is capable of setting the pace. However, the intrinsic rate of each cell is slower than the cells that precede. As you can see in the image on the right, the SA node has the fastest pacing activity. The atrial cell is the next fastest, the AV node, the His bundle, the bundle branch, and then the Purkinje cells. And as you can see, they decrease in speed as you go down. So if for some reason the SA node does not fire, or there's some problem there, the AV node will pick up, but it will fire at a slower rate. As you can see, 55 to 60 is the atrial cells, and the AV node at 45 to 50 beats per minute. Let's take a deeper look at each part of the electrical conduction system of the heart. As mentioned before, the sinoatrial or SA node is in the wall of the right atrium at its junction with the superior vena cava. It serves as the heart's main pacemaker, firing between 60 and 100 beats per minute. As we will see in future videos, it is most often supplied by the right coronary artery, but may also be supplied by the left coronary artery. And rarely, you may have supply from both the right and left coronary arteries at times. The three internodal pathways, the anterior, the middle, and the posterior, transmit the pacing impulse from the SA node all the way down to the AV node. There's also a small tract of specialized cells that are not shown here. They're called the Bachmann bundle, and they come across from the SA node, and they come, if you can imagine here, the left atrium. And they transmit impulses through the interatrial septum, right through here. All of the internodal pathways are found in the walls of the right atria and the interatrial septum. Like the SA node, the atrioventricular or AV node, which is shown here, as you can see, is found in the wall of the right atrium. It is located next to the opening of the coronary sinus, which is the largest vein of the heart, and the septal leaflet of the tricuspid valve. The AV node plays a key role in slowing the conduction from the atria to the ventricles just long enough to allow for the atrial contraction to occur. This slowing is key for allowing the atria to completely fill the ventricles with blood and help maintain a maximum cardiac output. While we saw that the SA node could receive its blood supply from more than one artery, the AV node is always supplied by the right coronary artery. Now let's move on to the bundle of His, or sometimes called the His bundle in the conduction pathway. We see that it starts at the AV node and comes down and gives rise to both the right bundle branch as well as the left bundle branch. It is found partially in the walls of the right atrium and in the interventricular septum. It serves as the only route of communication between the atria and ventricles. If we follow the left bundle branch, as you can see here, which travels through the interventricular septum, it gives rise to fibers that innervate the left ventricle and the left face of the interventricular septum. It causes depolarization of the upper segment of the interventricular septum. The left bundle branch ends at the beginning of the left anterior and left posterior fascicles, as you can see here. So it comes down and ends right about here before it gets to the left posterior fascicle, and comes down also and ends before the left anterior fascicle. Now if we look specifically at the left anterior fascicle, which we said starts as the left bundle branch ends, it is also known as sometimes you'll hear it as the left anterior superior fascicle. It travels through the left ventricle to the Purkinje cells that innervate the anterior as well as the superior aspects of the left ventricle. And note that this is a single-stranded fascicle, and this will be different that you'll see, as you can see here, just one line compared to the left posterior fascicle that we'll look at next. Now when we look at the left posterior fascicle, again coming off the left bundle branch, we notice it has a fan-like structure. So you can see it's coming out, fanning out, compared to the left anterior fascicle we just talked about as more of a single-stranded fascicle. And this fan-like structure of the left posterior fascicle gives rise to the Purkinje cells that will then innervate both the posterior and inferior aspects of the left ventricle. And because of its fan-like structure, you can see why it is often difficult to block this fascicle compared to the single-stranded left anterior fascicle. So let's just review the innervations of the left ventricle quickly again. So we have the left anterior fascicle, or sometimes called the left anterior superior fascicle. This innervates both the anterior as well as the superior aspects of the left ventricle. And the left posterior innervates the posterior, as its name implies, aspect of the left ventricle, as well as the inferior. Now let's look at the right side of the heart and focus on the right bundle branch, which starts at the end of the His bundle, so right here it's starting, and gives rise to fibers that innervate the right ventricle and the right face of the interventricular septum. Just like the left anterior fascicle and the left posterior fascicle that we saw coming off the left bundle branch, the right bundle branch also ends with its associated Purkinje fibers. Finally, we will end this discussion with the end of the electrical conduction system, the Purkinje fibers. It is made up of individual cells just under the endocardium. These cells directly innervate the myocytes and initiate the ventricular depolarization cycle. So as we said, they come off both the right bundle branch. As you can see, these ones here are from the right bundle branch. And these here, right, the left posterior fascicle gives rise to these ones, and the few of the left anterior fascicle, both which come off the left bundle branch. All right, before we end, let's conclude by reviewing a few key points that we discussed in this lecture. First, we discussed that the right ventricle makes up the most anterior portion of the heart. Second, we said that the heart can be considered a 4-chamber pump. It consists of the 2 atria and the 2 ventricles that circulate blood through a closed system. The atria empty their blood into their corresponding ventricles. So if you imagine here, you can see the right atrium and the left atrium on this side. Both give blood into the right ventricle and into the left ventricle. The right ventricle then empties into the pulmonary circulation through the pulmonary artery, and the left ventricle empties into the peripheral circulation through the aorta. Next, we discussed the electrical conduction of the heart, which normally starts at the SA node, in which we call the pacemaker, and travels through the internodal pathways to the AV node. So the SA node, you can look at this image here, comes down through the internodal pathways that we discussed to the AV node here. There's then the His bundle that gives rise to both the right bundle branch to the right side of the heart and the left bundle branch that supplies the, as you can see, the upper interventricular septum and gives rise to the left posterior fascicle and the left anterior fascicle. This image is actually very good. As you can see, the left anterior fascicle, we mentioned what it innervates. So remember, left anterior, sometimes called superior fascicle, innervates the anterior and superior aspects of the heart, and the left posterior fascicle, which innervated both the posterior as well as the inferior aspects of the heart. And as we go through from the His bundle to the left bundle branch, that gives rise to both the left anterior and left posterior fascicles, and then the right bundle branch, this ends with the Purkinje fibers. And from the Purkinje fibers, these directly innervate the myocardial cells. And from this, they spread by direct contact with each other. As we just mentioned, the SA node was considered the pacemaker of the heart. And we said that it normally fires between 60 and 100 beats per minute. Remember here, this image over here. It is the fastest pacing activity and normally sets the pace for the cells that follow it. Finally, another important point that we mentioned was that the conduction system of the heart has a backup system, just like any other system in the body. And for instance, if we have the SA node that fails to fire, so we have the SA node, say it doesn't fire here, there's a problem, the AV node will notice it and depolarize at its own rate. Now notice the AV node, as we mentioned, is a slower rate. And this will now set the rate for the cells that follow it. And that's all we have for this lecture. While this lecture may seem quite introductory, it is critical to have a strong foundation of the basic anatomy of the heart and its electrical conduction pathway. When any area of the conduction system of the heart is disrupted, we will often be able to note that pathology on the EKG. Therefore, this basic understanding will serve essential as we move forward.